Good afternoon, everyone, and welcome to another edition of Doctors Go Live. My name is Amirul, and I will be your host for today's live stream. Welcome and welcome once again to our live stream, folks. So I can see people popping inside the comment section. They're coming in. If you are tuning in, folks, you're about to tune in. I have one small favor to ask of you. Get yourself a cup of coffee because today is going to be a very long discussion, a very fruitful one, because we're going to talk about topics that are important to every man's heart. What is it about? I'll tell you later. In the meantime, all right, if you are already inside our chat function, maybe you can make some noise. Maybe you can tell me perhaps where you're coming from, where you're tuning in, KL, Sabah, Sarawak, JB, Penang. Is the rain affecting you? I hope not. And maybe you can tell us where you're tuning in, whether it's from the comfort of your own home, or perhaps you're taking time away from work, all right, or sneaking away from work to tune in. If that's the case, I want you to know your secret is safe with me. I won't rat you out to your boss. Now, folks, as the people are coming in, all right, perhaps we can kickstart first, okay? Now, as most of you know, today, all right, this month actually, it's the month of November, also known as Movember, the month where we highlight men's health, raise awareness, and talk about things that we're usually avoiding, especially the uncomfortable ones. And when we talk about uncomfortable topics, no topic scares the living bejesus when it comes to male. It's two things, folks: premature ejaculation and also erectile dysfunction, short for PE, and also ED. Now, before you panic, right, I want you to know, every single viewer here, that you are not alone. This is why we have this discussion. It provides us with a safe, all right, and non-joking environment for us to dish out this issue, talk about it like grown-ups, and at the end of the day, find solutions for this issue that is plaguing males everywhere. Yes, everywhere. Now, in fact, all right, folks, these issues when it comes to PE and ED, they're so common, you won't believe it, all right? And that's what's going to surprise you. Now, I won't be dishing out the exact stats for PE and ED. That's not my role. That will be the role of the guest speaker here today. But what I can tell you is this: statistically speaking, if you are a male and you're tuning in, all right, from stats alone, you yourself are suffering from PE or ED, your friend, your colleague, or the person who is sitting right beside you, okay? Maybe they are actually suffering from the same thing. And you don't have to go through alone. That's why we here at Columbia Asia Hospital, we're here for you to address these topics that no one wants to talk about. And also, if you have your partners tuning in, I also want to fist bump you. Thank you so much for being here, because it means a lot to our folks out here today. Now, before we proceed further, okay, throughout the entire session, there will be prizes to be giving out today. Yes, you heard it, prizes. What kind of prize? It's a mystery. But in order for you to win those prizes, you're going to have to stay tuned. Don't go anywhere. Share the live stream and answer the pop quiz that will be coming up at the end of this presentation. So if you want to win those prizes, stay tuned. Don't go anywhere. Until then, we have a short video to recap or give you a glimpse about the topic that we'll be discussing today. Roll it, video.
Hi. Let's be honest. Men don't always talk about their health, especially when it involves things like premature ejaculation or erectile dysfunction. But these issues are far more common than you realize. I'm Dr. Vijayan Manogran, Consultant Urologist at Columbia Asia Hospital Setapak. In this upcoming episode of Doctors Go Live, I'll be breaking down what really causes these conditions. Join me on 26 November at 3 p.m. and let's talk about men's health openly and confidently. See you there.
All right, welcome back, everybody. I hope that little intro gave you a glimpse about the topics that we're about to talk today. For those who just popped in, welcome once again to a special live stream edition of Doctors Go Live, brought to you once again from Columbia Asia Hospital. All right, today we're going to once again talk about premature ejaculation and also erectile dysfunction. Now, men's health is often talked about when something goes completely wrong. And even then, we tend to stay quiet, all right, pretend it's nothing, and MacGyver our way using Google, all right? We're always finding medical solutions on the internet. It's crazy. Now, the truth is, conditions like PE and also ED, they're more common than you think. It's not rare, it's not shameful, and there's not something to be ashamed or for you to face alone. A lot of men, especially, they keep themselves with this secret for years because they're afraid to being a judge or even misunderstood. But these issues, all right, with erectile dysfunction and premature ejaculation, they're caused by so many different factors. Some of it stress, some of it lifestyle changes, and some of it because of underlying health issues. That's why conversations like this exist, because we need to tell people the problems, the causes of these problems, and perhaps by then tell people that there is a cure, there is a solution at the end of the day. So once again, if you are just joining us, welcome to One of a Kind Talk, held in conjunction with Movember, where we're going to talk about sensitive topics for males. So, without further ado, before we continue, right, with our presentation, there will be a chat function, all right, in our live stream here. If you have any questions, any burning questions in any part of the segment during the entire live stream, you can actually drop them inside the chat room function, and we will be reading them out at the end of the presentation. So stay tuned. Do drop the questions. Be a busy bee. Until then, to help us understand, okay, these conditions better, we have someone very experienced with us here today. Ladies and gentlemen, it is my great honor to welcome the guest speaker for today, all the way from Columbia Asia Hospital Setapak, our very own consultant urologist. Please welcome Dr. Vijayan Manogran.
Hi. Good afternoon, everybody. Good afternoon, Amirul. Thank you for having me.
Good afternoon, doctor. Looking very good. It's like I would just walked into a, looking at your background set, it feels like I just met George Clooney after 16 seasons of ER. That's how good looking this man is.
Thank you. But George Clooney minus the hair. Yeah, that's fine.
Still good looking. All right. Now, Doctor, thank you so much for joining with us here today. It's an important live stream. It's an important topic to discuss, and really appreciate the time you are spending with us here today. Now, right off the bat, before we go into the slides, right, perhaps you can give the audience a little bit of an intro about yourself, your background, and the number one question in everybody's mind: why did you choose urology as your specialty?
Thanks. Okay, so just a quick background about myself. I've been in urology for many, many years. I just left the government service. I joined Columbia Setapak, and urology, why? It is the field where boys play with toys. Urology is one of the most advancing area of medicine. Lots and lots of new technology. So we always say this is the field where the big boys play with toys. We get robots, we get new scopes, endoscopic, tools, lasers. So we are generally big boys with toys. We like to play with this.
Wow. Well, I like the description. It makes me want to actually turn back the time and take medicine for myself. Now, when it comes to toys, what exactly are we talking about here? What kind of toys are we playing around with?
Oh, yeah. So, I mean, urology is a very advancing field. It's in the forefront of many, new developments, including endoscopic surgery, including robotics, lasers. The usage of lasers in urology is very high. So we tend to play with the new toys, and we have it available for various treatment options for various urological diseases.
Wow. Okay. You know what? Just from that description alone, I can tell you one thing. George Clooney, right, has nothing on you. You are leaps and bounds in front of George Clooney. Go off, George. All right, let's dive into the topic. Can we have the presentation slides for us? All right, here we go. The big topic of the day. Now, doctor, let's start with the basics, all right? Why is it so important for us to talk about these two major topics?
Okay. Why is this topic important? The reason I can tell you straight off the bat straight away, it's because it's not talked about enough. It's something that is common, but Asians being Asians, Malaysians being Malaysians, we shy away from these things. We tend to get a little bit apprehensive approaching or talking about it. We tend to keep it within ourselves. Men are macho. You're not supposed to show that you have these problems. But in the background, you are bothered about it. You're bothered about it enough that it disrupts your usual life. So these are things that you need to talk about, but you're too shy to talk about it. You don't know where to go. Who do you approach? You know? So this is something that you want to talk about, but you don't know. You don't want to talk to your friends. Your friends are going to turn around and say, hey, what's wrong with you? You know? So it's a bit of a taboo subject, but it's something that needs to be faced.
I completely agree, Doctor. I mean, I think when we look at social media or movies in general, right, they always make fun of people suffering from these type of conditions, and I don't think that should be the way, because when I look at the stats and also the science behind it, actually a lot of males are actually suffering with it, and I will thank people like you for shedding light on this topic. So, on behalf of the entire male population, I'm going to give you a round of applause. You're championing us right there, right in the field. Now, doctor, before I go continue further, right? Do you see a trend? I mean, on the many years you've been in a urologist, right? Do people come towards to consult you more these days as compared to last time?
Yeah. You can see in the last, 10, 15 years, people have started to open up a bit more. And you tend to see them coming to the clinics more compared to before, when people really didn't want to talk about it. But now they tend to come. They know there are some treatment options available. They want to find out more. And partly because some of these conditions are linked to your general health also. So when the patients go and see other doctors, namely the cardiologists and all that, they do get referred over to the urologist because there are these underlying problems associated with their other underlying diseases.
Mhm. That's an interesting topic, but let's move further. I have a few questions on my own just from the statement alone. Now,
Yeah.
let's move on to the next slide because it's a perfect segue, all right, for us to kickstart our discussion. All right, doctor, let's begin. Okay. Now, how common is it when it comes to PE and ED, not just in Malaysia, but in the whole world?
Yeah. So if you look at the data that's shared here, it's worldwide, they say it's about 30% for PE, okay, estimated. And the interesting thing is, from data they're saying is highest is apparently in Southeast Asia. And in Malaysia, various studies have quoted numbers between 21 to almost 50% for just PE alone. If you look at erectile dysfunction, the numbers can vary through a huge range from 3% up to nearly 75%. Okay. And we see this normally with increasing age. And as I said before, there is linkage with other problems, namely your cardiovascular problems and diabetes. And with in Malaysia, the latest statistics or the last statistics was the 2019 National Health Morbidity Survey. It actually found that nearly about 80% of sexually active men who are 18 and above had ED somewhere along the line. You're talking about mild to moderate ED. So it's not uncommon. It is common. It's just that this is a questionnaire they were daring enough to fill up these forms because it's anonymous. But how many of these patients translate that to come and seek treatment? The numbers are increasing, but compared to before, but it's not a lot yet.
Well, doctor, you bring up a good point. I mean, these stats are actually quite alarming. It's not something that popped into my mind. I thought the numbers were actually lower, but the figures are high. Now, especially when you say that it's highest apparently reported in Southeast Asia. When it comes to Malaysia, why do you think the numbers are increasing? Why is it?
Okay, so ED, very easy to explain. The
Mm,
obesity, diabetes, the number of people in Malaysia having this problem is increasing exponentially. We are the highest in Southeast Asia, some even say South Asia for that matter. And because of that, these diseases have an indirect effect which is related to erectile dysfunction or worsening erectile dysfunction. That's ED alone. Premature ejaculation is a different hodgepodge of problems on its own. Okay, yes, the numbers are high. Why? What is the issue there? Okay, is it the expectation, the social media? So PE is a little bit more different than erectile dysfunction. So that is something that people don't want to talk about. The younger people, you tend to see a lot of the younger generation having problems with premature ejaculation because of expectations. Their expectations versus what is reality, right?
Wow. So that's quite the answer. You've got health, folks. Well, again, you are what you eat. So you got to be careful, it can cause problems like PE and also ED. But also, the doctor said just now, it can be psychosocial. All right. We're going to dive into that later. But the next slide, all right, is something that I want to talk about. Now, we've covered how common it is, but I want to ask you, doctor, all right, is age a determinant when it comes to these issues?
Okay, in general, I would say no. But in reality, ED is known to be more prevalent in older age men. And why is this so? Well, you can see this because as you age, you tend to get other comorbidities along the way. Okay, that's what I said earlier. But can it be seen in younger men? Yes. Why? Okay, smoking is becoming more and more common. All right, we know smoking is a common denominator in relation to causes of ED and even PE to a certain extent. Now, question is, does vaping cause it? People are now changing. I say, oh, doctor, I'm not vaping. I'm not smoking anymore. I'm vaping. Vaping can cause, we think so. We think the mechanism is the same. We do not have long-term data yet to support that, but we suspect that is also a contributing factor. Now, even in younger men, as you said earlier, the psychological issues, what is expectations? What is social media here? Why? Because it's so easily available. I mean, porn is a taboo subject, all right? But it's easily available. You can get it online compared to years ago when you can't get it. Now it's easily available and people see and they expect that they can perform similar to what they see. But in reality, that is not really true. So where is expectation and where is reality? And they get worried about this.
Unbelievable. So it's not just about age. It can happen to anybody. But in your experience, right, Dr. Vijayan, I mean, I just want to know, with social media popping up and people's awareness about these issues coming up, in terms of your patients, roughly, I mean, how many do the younger patients outweigh the old?
Oh, yeah. So when it comes to PE, I tend to see quite a number of younger patients coming in. College students, university students coming in, they're worried. Why? Because when you dig and you sit down, I mean, I call it, you really fact-finding mission. You sit down, you spend nearly an hour with them trying to go through, you'll end up realizing that, they are expecting themselves to perform like what they see on social media, on the internet, when in reality, that's not necessarily true. They go in with the expectation that they can perform well, especially with premature ejaculation. They can perform and hold for a long time. But in reality, that's not really true, So these are things that they have in their mind that they think, oh, what I see is what it should happen to me, but it's not. And then they get scared. They say, hey, look, I'm not like that guy on the show, So something's wrong with me. Then they come and then they say, oh yeah, doctor, I have PE. Yeah, you talk to them, yes. But they don't realize that is all staged. There are things, So there are things that, affects their psychosexual emotions, expectations, and these actually are determinant in whether they actually really have PE or not.
The psychological aspect is actually very fascinating. Who thought, right? Who knew that what you see is not really what's real? And
Yeah.
that's a large contributing factor to individuals who don't perform so-called.
Yep.
Now, actually, we've spilled over to the next slide because the next slide is actually stating the causes of PE. Dr. Vijayan is like Vin Diesel. He's fast and furious, but he's here to equip us with the knowledge. So why don't you go ahead, Dr. Vijayan? Maybe you can tell me the causes of PE.
Okay, so there are actually many different causes for premature ejaculation. All right, there are the physical causes and you also have the psychological causes. Now, if you talk about the physical causes, there are people with hormonal imbalances, such as hyperthyroidism, where your thyroid is overactive, and you can get this problem. Of course, there are others who have chronic inflammation of the prostate, and that can also lead to PE. Other issues, these you're talking about chemical imbalances, the neurotransmitters, where there are serotonin receptors and there are variations. And some people are just too sensitive and they unfortunately have to release fast. Okay, things like diabetes, high cholesterol, metabolic syndrome has been postulated to cause this, and some are related to medications, whether legal or illegal drugs. And of course, along with it, if you have the presence of ED with it, you may potentially have the problem of premature ejaculation. That's one. Now, if you talk about the psychological aspect, this is usually the more common cause that we find, is the anxiety. This is related to performance anxiety. Like I told you earlier, they want to perform, they want to be as what they see. The partner expects them to, they also expect themselves to perform very well, and then they don't. And that leads to a next point, which is depression and guilt, because they can't perform. The cycle just perpetuates itself. It just repeats. The cycle just keeps going on. And this leads to potential relationship problems also. And the relationship problems makes it even worse. So the cycle just keeps getting bigger and bigger and bigger and bigger. And another aspect of this is where the early sexual experience. Some psychologists say that the early exposure, all right, of the individual to what you call these sexual processes, okay, I would say that way, makes them get exposed too early. When they get exposed too early, they get involved too early, and then subsequently, they may not actually perform as well. You see, they're just too exposed early, and they lose that stimulation because it looks the same. All right, they can't. All right, so these are things that may be related to PE, and in effect, it may go on to ED also as a consequence.
Wow, actually, that is quite the info to actually unpack here. So it's a mixture of physical and psychological. It's not just in the mind. But I want to circle back to this issue about early sexual experience. So are you saying that with early exposure to sex, they become more, how do you say, um, they've again don't get aroused, or they don't get excited, or the baseline is dropped? How do you?
Yeah, so the baseline can change too arousable, too easily arousable, okay, where they start really, they get excited, sexually excited, and they just cannot hold. They're not mature enough to realize that this is just a normal hormonal phase that they're going through. So they get premature ejaculation. And it also can go to the next stage. Like I said, it can too early, you get exposed, you get used to it, and then over a period of time, you may actually lead to erectile dysfunction because it's just common already for you. You don't feel the stimulation anymore. That's the other extreme.
Wow. Now, since we're talking about ED, it's a great change to the next slide. We're shifting from PE to ED. Doctor, maybe you can dish out what exactly is the causes for erectile dysfunction?
Okay, so with erectile dysfunction, most of them tend to have both the psychological and there's a physical aspect to it. We see the older patient, especially those with coexisting issues like high blood pressure, high cholesterol. Okay, all this leads to what we commonly see is cardiovascular disease. That's what everybody talks about. Oh, the guy was playing, suddenly collapsed, and say, oh yeah, he had a heart attack. But if you look at it, the cause behind it is what we call atherosclerosis, which actually is the hardening and narrowing of the blood vessels. This leading to heart attack because it happens in the vessels with the heart. But in reality, the start of it happens with atherosclerosis in the blood vessels to the penis. That is where this initially starts off. And if you ask a cardiologist, they'll tell you that the early signs that you may see is ED before even any of your heart attack happens years later. So this is why this issue of high blood pressure, high cholesterol, and even diabetes, okay, all these three things will lead to damage of the nerves and blood vessels over time. And one of the commonest organs being affected is the penis. And that is why you end up getting erectile dysfunction. That is one major cause, and that's a common cause. There are other issues like Parkinson's, multiple sclerosis, where any damage to the nervous pathway, this can present itself with erectile dysfunction, and this is very difficult to treat. Okay, other issues, hormonal, and this happens in older men. As they grow older, they get what they call as hypogonadism or low testosterone, or again thyroid issues, hypothyroidism and all that. They can have this problem. Other common things we tend to see are patients who undergo surgery, pelvic surgery, okay? Namely, commonly now, we're talking about Movember, and we're talking about prostate. A lot of people talk about prostate cancer in the month of November. Now, prostate cancer, one of the common surgeries that are done is prostatectomies. You remove the whole prostate. Or you end up going for radiation, okay? Radiation treatment for the cancer. And these, in general, can cause erectile dysfunction because the nerves are around the prostate where you are doing the surgery or where you're doing the radiation. It does affect, it can affect and cause erectile dysfunction. And there is treatment for that. There is treatment available for that. Of course, the common factors, other factors, your behavioral factors, smoking, excessive alcohol can lead to erectile dysfunction. And that we are just talking about the physical causes here. Now, if you talk about the psychological causes, again, it goes back to what I was talking earlier. You can have depression, you can have anxiety, stress, work stress, family stress leads you to not being able to perform. This is quite common also. I tend to see both husband and wife coming in and having this problem. And when we dig through it, we go through it together, we realize there's a lot of expectation and disappointment between the partners, which leads to further stressful relationships and further poor performance. And that is a completely different thing altogether. And on top of it, like I said earlier, this brings about the issue of conflicts or communication issues between the partners. You know, some don't want to go and say, look, I'm tired, I really can't perform today, I'm just not in the mood, work is just too stressful. Partner doesn't realize it because there's no communication and expectation, and the cycle just keeps going on and on and on.
Okay. Now, from these two slides alone, right, from the causes of ED and also PE, my heart sank because these are a lot of causes, okay? It's scary, but I like the fact that Dr. Vijayan saved it just now because he said there is a solution to some of these issues. Now, just on this slide alone, right, Doctor, I want to understand, in your line of experience, is it mostly the patients that you see? Is it mostly physical, psychological, or predominantly a combination of both? I mean, where do we stand in terms of
Yes.
patients?
So of course, when we see patients, it can be a mixture. It can be purely psychological. It can be a physical. A simple example, as I was telling you earlier, a patient who goes for a radiation therapy, okay, that is a physical cause. That is definitely, look, this guy has had radiation. It's fried the nerves. There is going to be some element of erectile dysfunction. In fact, they may already have some form of erectile dysfunction prior to treatment, and after treatment, it gets worse. Now, can that be treated? Yeah, there are ways, there are ways of helping this. It can be treated unless it's totally, totally bad, but there are ways of treating it. That is from the physical cause. I'm just giving you an example. But the psychological cause, there are people who come in, they need to discuss this through. It's best if they have their partners along. And a lot of times we talk about psychotherapy, okay? There are licensed psychotherapists who actually can sit down and talk about this. But if you actually sit down and talk to your doctor and you openly talk about it, a lot of times you can actually identify the problems and you can just tell them, look, hey, you need a solution here. It's basically talking to each other. You need some time off. You need to get away from your work and all your appointments that you are rushing for, and need to find some time to spend with your partner. And these some simple things that can actually help things move along.
All right, Dr. Jen. We're going to continue, but before that, I'm going to take a short commercial break to address the comment sections. All right, we have a couple of people commenting over there. Thank you so much. We've got one from Yiki. I just want to give you a special shout out to Yiki. Yiki said, "Thank you, Doctor, and also Amiro, for normalizing these conversations. It means a lot, even from a woman's perspective." Thank you so much for Yuki for joining us. We're gonna dish out more information about these two topics. And Doctor, you'll be happy to know that you've already got your first question of the day from Ashley Chung, but I will save it for later. Okay. Now, moving on. All right, from the causes of ED, I want to talk about. All right, we've going through these causes of ED and PE, but you've been saying stuff about smoking and vaping and doing drugs, which leads us to our next slide. All right, maybe you can tell me now, okay, in the audience, all right, so we can get another heart attack. What exactly is the common causes for PE? Because if you're saying smoking, I'm gonna burn all my cigarettes today. That's it. I'm gonna throw them away. No more smoking for me.
Fair enough. I think it's a good thing if you do, because I'll tell you why. Okay. But going to PE, commonest, and this is based on what we tend to see, is performance anxiety, over expectation, both from the patient and the partner. Okay. Or like I said, with the era of social media, internet, in the last 5 years, 10 years, 15 years, things have just really, really exploded, and everything is available. Everything is available. And once it's available, people tend to see and they want to replicate it. They want to explore, And once they try to do all these things and they realize, we are not the same. They're not the same, and they're mature enough to understand that they're not the same is fine. But unfortunately, they may not be able to understand that part of it, and they think, I'm actually deficient. I'm having problems. And like I said, the performance just gets poorer because between the partners, there are issues, why can't you do this one? Why can't you do that? Why can't you do this? Why can't you finish? Are you having problems? So that guilt takes it to the next level. And subsequently, it just keeps overriding and keeps going on and on until you break that cycle. And you have to sit down and talk to them. Hey, look, are you having all this built up, pent up inside that you are saying, I think I should be able to last, but I can't because I want to, but I can't. All right. So that is performance anxiety with PE. Now, coming back to ED, commonest is all these comorbidities. Okay. I'm talking about your cardiovascular issues related with diabetes, hypertension, hyperlipidemia, or hypercholesterolemia. These are the commonest ones. And because it's so common in our society now. And then, of course, you have performance anxiety. And now with more and more surgery or radiation being done, you tend to see this also. And when you talk about smoking, you say, should I burn and put away all my cigarettes and, save the money? Yeah, that's it, Now, smoking leads to hypertension, all right? Smoking leads to worsening of your vascular issues related to the blood vessels itself, okay? That can happen with diabetes, hypertension, and your high cholesterol. So by stopping the smoking, hopefully you reduce that risk. And when you reduce that risk, it hopefully avoids having this problem.
I am stopping smoking, vaping, and anything. There's nothing I'm going to do after this. All right. But doctor, I want to ask, the two commonest causes of PE and ED, it seems to be performance anxiety. You tell me that it's all psychological, right? You need to sit down and work things out, etc. But a rough timeline, right? In your opinion, how long does it take to actually cure oneself out of performance anxiety, since it's psychological? Does one session you help? But I mean, audience is actually.
It varies from patient to patient. How willing are they to expose their deepest insecurities? Okay. Now, if you sit down and talk to them, there are a lot of insecurities with them. And when you do find that, and you sit down and you go through with them one by one, and you tell them it's a physical and emotional insecurity that affects them, okay? And this insecurity will lead to this performance anxiety. So that feeling of fear is a lot of times is something that you have to give them some time to overcome. And I have had patients who, one session was enough. I have had patients who came after 2-3 sessions, then they say, hey doc, things are looking much better now. It takes time. So building the rapport, going through, discussing, taking it deeper, at every session, if there is something deeper, the layers that you have to peel back to get more history. And this is good if it's done not just with the individual. Sometimes it's good with the individual because they don't want to talk with their partners, but sometimes the problem is with the partners together. And that adds another layer of complexity to it.
Okay. One more question before we go on to the next slide, right? I just want to ask, okay. So tell me, right, even if somebody goes to you to talk about, performance anxiety, what's the best case scenario or worst case scenario? I mean, so the audience can understand, like, oh, if I pour my heart and soul to you, all right, I treat you, right, as one of my own, I tell you everything, we share deep, secrets. What's the fastest recovery and slowest recovery?
Oh, I mean, performance anxiety wise, if you actually bare your soul and you are willing to face your demons, your fears, I think that one session is more than enough. If you're willing to, open up and face it, it's fine. It will work, and it has worked before. All right. I think that is just one session can be enough.
Wow. See, folks, one session, it could be determining, solution for you. So don't be afraid to talk about it. Go out there, go seek help. And if you are seeking help, don't look anywhere further than Columbia Asia Hospital, especially Dr. Vijayan. All right. Now, going to the next slide, okay, I want to talk about a different issue. Now, a lot of people, right, because of performance anxiety or the various questions they have in their mind, because when I see things and I don't perform to the best of their ability or to what I see on TV, am I suffering from ED or PE? How do you determine whether you actually have these things?
Okay, so with premature ejaculation and also erectile dysfunction, these are based on patient symptoms. Okay, the common thing that they will say with premature ejaculation is, if anything, they'll come and say, look, I have a premature ejaculation. Why? Oh, because I ejaculate before I can even achieve penetration, and then you dig further. Some people come in and say, hey, I have premature ejaculation. How is that so? Oh, I can achieve penetration, but I don't last long, and then I ejaculate. So that is not fully premature ejaculation itself. Okay, so there are different degrees to it. That's one. Second thing is it a one-off experience? Okay, or is it something recurring? It may be a one-off experience. You're excited about meeting your new partner, somebody that you're hooking up with for the first time, and you're so anxious, performance anxiety, and then lo and behold, before you can even do anything, you ejaculate. Okay, but that may be a one-off thing, all right, because you're super excited. All right, so these are things that we tend to go through. If it's a recurring theme, then it's something deeper. There are issues. Okay, and like I said, we tend to rule out organic causes. That means causes that can be treated. Certain things you do a history and examination. Occasionally, like I said, you're worried about thyroid functions, you're worried about testosterone, you may need blood tests to do it. Okay, and like I said, you really need to connect with the patient. The patient needs to be able to open up. You need to have an open discussion into personal space, the deepest fears. What is this? And this is why I said the psychosexual analysis is very, very important, especially for PE. With ED, again, similar thing, but it may be easier because with erectile dysfunctions, there are scores. There's erection hardness scores. You can actually use it to determine ED, severity of it, and there are questionnaires that you can fill out. So there are easier things that we can do with erectile dysfunction compared to premature ejaculation. And the thing is, a lot of it is associated with many other factors, like I said earlier. All right. So you can actually go, you can tick through and see. It's very easy. You can actually tick through and see. Do you have this? Do you have this? Do you have this? And say, okay, you have been having this. There is a possibility this may be related to that.
All right, doctor. So it's a lot of issues to solve in order to see whether you really got either PE and ED. So
Yeah.
usually, in order for you to assess an individual, right? When do they usually come to you exactly? At the beginning, or when things are already severe enough, or as it is?
Oh, so you'd be surprised. There are people who come at the start. There are those who come late on, and these individuals are, their expectations are different. So the expectations are different, and if for me, I can just tell you, you sit down with these patients. It's not a 5-minute consult. You really need to sit down and spend time with them. You really need to find out, like you said, they come early, it's a different ball game altogether. You really need to go deeper and deeper. And if they come late, also you really need to go deep into the history. What exactly triggered it? Where did it start from? If this is a long-standing issue. If it's a long-standing issue, what are the causes and can it be treated? Can we find it? It's a bit of a hunt, trying to see where is the source. Where did it begin? Why did it happen so? And if you can find that, a lot of times you can focus on that and try to get things sorted out.
So it could either be a simple issue or a multitude of problems. It really depends on the individual. That's why, folks, you
Yes.
really need to get yourself checked. Don't be shy. Go and book that appointment. All right. The more you know about yourself, the more solutions you're gonna find out. Now, all of these items, right, I see on the slide, right, leads me to my next slide and also my next question. All right. Are all of these, all right, a sign of serious health conditions? Is there an underlying problem with people suffering from PE and ED?
Okay. So I'll give you the easy answer first. With premature ejaculation, usually no. All right. Premature ejaculation, usually no. With ED, as I said earlier, yes, there are potential issues, especially if it's related to patients who do have cholesterol issues, diabetes, or high blood pressure. Why? Because erectile dysfunction precedes a heart condition. You're talking about a 50% higher risk than the normal population to have a heart issue because of these underlying conditions. Okay? So if you are truly aware of what's happening, a lot of times the ED starts off first as one of the first few signs or symptoms you put, in a patient who has this multitude of medical problems before they even get a heart attack. Okay, but it's just that people don't talk about it. They'll just say, oh, when you ask them, say, oh yeah, I've realized I have not been able to perform for the last few years. It's not as hard. It's not as it doesn't arouse easily. So these are the things that is there, but people don't ask. People don't talk. They get carried away with the heart issues or the fear of the heart. They don't ask about these issues, and these issues can precede it completely.
It is also a major concern for me right now. I'm touching my own heart. Am I having a heart attack? I'm actually quite worried. A lot of people associate heart attacks with obesity. Are you saying also that being morbidly obese can also lead to ED?
Yes, so
Oh,
obesity on its own, now they call it metabolic syndrome, all right? Where you have the triads of obesity, hyperlipidemia, and diabetes. Okay, so obesity is just another syndrome, okay, where all this is put together and is associated with this. So yes, obesity is at fault also because you end up having all these few issues together, which leads to a raised BMI or waist to hip ratio, whichever one you want to use. But these are associated because the underlying causes are the same.
wow. Well, this is a lot to unpack once again. So, folks, I'm going to quote Alvin Lam from the comment section, right? He says, healthy heart, healthy mind, and healthy body. That's correct, Alvin. Alvin also is giving a thumbs up and a fist bump to Dr. Vijayan over here. He says, great job, tetap padu. Well, tetap padu to you too, Alvin. Thank you once again for joining us. Do spread the word about ED and also PE to your pals, okay? And also share them the live stream, which is currently live right now. All right, moving on to our next slide, shall we? Okay, doctor, okay? When it comes to PE and also ED, especially for those who wants to conceive kids, does it affect fertility? Should parents or couples be worried?
Okay, so in general, all right, premature ejaculation shouldn't affect fertility, okay, because it's not that the sperm quality is affected. No, the sperm quality is generally maintained. It's just that it can be harder to conceive because you cannot achieve sexual penetration. That is the issue there, okay. And like I said earlier, when you can't achieve a sexual penetration and you ejaculate prior to that, you get anxious, and this leads to further reduction in sexual activity. And of course, these are the things that are a physical relation to it. Now, in some rare instances where I said the hormonal issues may affect, and I talk about specific hormonal issues, they're talking about low testosterone. Now, if this is there, and this is not common, if it's there, yes, it can affect the semen quality. Your semen quality can reduce if there is hypogonadism or low testosterone levels related to premature ejaculation. Whereas with ED, okay, yes, you cannot have an erection physically. Your erection is a problem. Let's just say, I put it this way: you go for a surgery and a prostatectomy, and your erection is completely gone. Okay, now there are ways to treat this, but in some instances, it needs a mechanical intervention. And in that sense, if that is the case, you cannot conceive through sexual intercourse. All right, you can't. And there is a physical impact. And with that, okay, of course, again, the same thing, you can't perform, it leads to further reduction in sexual activity. Okay, now the other issues related to infertility, okay, and this is not just directly due to ED, but the fact that ED is caused or may be associated with diabetes, hypertension, smoking. These things can also, cause infertility itself. Smoking especially, all right? It can cause a poor, semen quality and leading to infertility. Again, low testosterone, hypogonadism as a cause also can affect the semen quality and sexual function related to ED. But the quality otherwise in general is maintained. The quality otherwise in general is maintained. It's just with ED alone, all right?
So between those two, it would seem that erectile dysfunction is worse than premature ejaculation. At least with premature ejaculation, the sperm quality is still maintained. But with ED, you were saying something about you would have to use mechanical intervention. What exactly is mechanical over there?
Okay, so if you're talking about the next part of it where we talk about cure, okay, for erectile dysfunction, there are different versions that, different ways of treating them. Of course, you have the psychosexual side of it, but you also have the medication side of it, where in terms of medication, there are the famous, Viagra, Cialis, and things like that. That's medical treatment. But if that fails, there are other things where we have alprostadil injections and all, which I'll go through later. Then you also have the vacuum pumps, and in worst case scenarios where you have the erection devices, okay, or malleable or those pump activated implants, where you can actually implant them. And this has been done for patients post surgery where the erection does not respond to any form of medical treatments or injections or even vacuum devices, where the erection is induced by using a mechanical pump. So in that sense, you do not have an ejaculation, unfortunately, but you have erection where you can have a pleasurable time with your partner.
And even if you have a pleasurable time with your partner, right, can they conceive because there's an erection? Can they conceive a child through that means? Yes,
Usually no. Usually no.
All right. But you know what? All these type of solutions, right, is what you said going to be dished out in our next slide, which is the cure for PE and ED. This is where everybody will be attentive. All right, we are here down on our knees telling Dr. Vijayan, save us. Tell me, how do I be cured from PE and also ED? Take it away, doctor.
Okay, so there are treatment options, like I said earlier. Okay, and I think I preceded the slide, but basically you're talking about behavioral techniques, you're talking about medications, you're talking about surgery for ED, for PE. Okay, PE itself, the behavioral techniques are different, the medications are different, and a lot of it involves counseling also. Medications. There are issues with medication. There are no actual real indicated medications that's really totally available. There are some, but we are very, very cautious with using them. A lot of times, like I said, this counseling part takes precedence. The behavioral techniques takes precedence, but in those rare instances, we can try medication for PE. Whereas for ED is different. And ED, there are also behavioral things. There are medications, like I mentioned. There are uh, hormonal treatment. There are counseling, and also there are devices, as I mentioned earlier. And I can go through that. We go through the slides, and I can, try to talk to you, take you through one by one.
All right. Thank God the slide just popped in on its own. Might as well you take it straight away. What are the treatment options for PE?
Okay. So if you go through the treatment options, okay, for PE, okay, behavioral techniques, and this is something that you really have to sit down and tell them, okay, how do you do this? There are start stop techniques. Okay, what we call a start stop technique is basically there is stimulation until the urge to orgasm, then you stop before you even orgasm, before you even release, you stop and you let the urge pass, let it settle down, and then you start again. This is basically building yourself to get used to the stimulation so that you get sensitized to it, so you can hold on a little bit longer. And this takes time. This is a repetitive thing, it takes time. This is what we call a start-stop technique. Of course, people talk about pelvic floor exercises or Kegel exercises, strengthens your pelvic floor muscles. You can do that. Okay, there are many, many videos available again on social media, on internet. It's readily available. And then simple things like having your own time, masturbating before meeting your partner for intercourse. This delays everything. This prolongs the episode that you have, there's an intercourse that you have with your partner. So things
Right.
like this where you can reduce the sensitivity or the sensitization, you can actually try to prolong the session. So these are behavioral techniques we can talk about. Of course, there are medications, like I said, but it's not so commonly used. Many people talk about the topical anesthetic agents or sprays or gels that you can apply on the head of the penis prior to intercourse. Yes, there is some evidence to say that may work, but it's not necessarily true. The side effect is that you may anesthetize your partner's genitalia also. So that's not something nice to have. Okay. Then there are other medications like selective serotonin receptor inhibitors, SSRIs. I talked to you earlier, much earlier, about serotonin. Now, one of the drugs that are used are dapagliflozin, but the issue with this drug, and it's been highlighted before, there is a tendency for higher suicide risk. So we are very, 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 very cautious using this. Okay.
Mm.
Now, another medication is tramadol. Tramadol is, if for those who know, these are painkillers. Okay, these are painkillers. Now, with painkillers, you can actually use this tramadol. It's off-label indication. It is not actually meant for premature ejaculation. It's along the way. People have found that it does help delay the ejaculation. Okay, so there are people who we have used this on, and it does work to a certain extent for those who don't respond to other things like behavioral techniques and counseling. Okay, and of course, a cornerstone of treatment is counseling. Where you talk about the anxiety, relationship issues, fears. This is where I say a lot of times we start from here and we go through, and sometimes you get away with dealing with just this alone, this part alone. All right, and that is for PE itself. That is for PE itself. For
Okay.
ED, it's slightly more.
All right. But before we go to ED, all right, I want to stop you right there
Yeah,
because I have a few questions, from the
sure.
floor for myself as well. All right. Okay. So I've always, when it center around behavioral techniques, it's always a myth that movies. I thought that masturbating before intercourse, I thought it's a myth. That's actually true. It helps
It is true.
delay ejaculation.
Yes,
What
it
about
does.
people who over masturbate or masturbate before intercourse? They can't, perform because they've already done the deed. You don't get aroused already because, hey, I've already done it. I don't get aroused anymore.
So this is where the partner comes in. Foreplay is a very, very, very important part of the sexual activity. Okay,
Mm.
and a lot of people forget about foreplay. They just want to go straight for the session. That's it. Foreplay is actually one of the most important parts of having sexual intercourse, and in fact, where there is the most arousal for both of them. And if you concentrate on foreplay, even if you have masturbated before, you shouldn't have any problems having an erection. All right, having erection, you avoid having a premature ejaculation because you are desensitizing yourself for a period of time. Now, foreplay, there are many, many ways of doing it, many different techniques. Each couple has to explore and find something that suits them, and they have to be adventurous because it's not the same for everybody. So foreplay is a very important component that many people don't talk about. They avoid it, but thinking that the deed is just getting it done. That's wrong. The foreplay is a very, very important component, and the communication between the partners will be the one that tells you, how far can they take this? Can they overcome these issues? That is important.
All right, thanks so much for dishing. Dr. Vijayan, we're going to have to take a small commercial break before we continue with the treatment options for ED. Folks, we're going to go and to our quiz section. Throughout the entire session, we've been telling our audience, right, that if you stay long enough, all right, we'll be giving out prizes for those who participate in our quiz section, all right, where you answer a couple questions. If you get it correctly and in the fastest time, you'll walk away with something mysterious all the way from Columbia, Asia. Now, I can't tell you what it is because it's a mystery, but what I can tell you is that it's not going to be a house or a car, okay? But it is something very nice. Now, before we continue, right, in terms of how do you participate in the quiz, all right, there are three simple steps for you to choose from, for you to adhere to, folks, all right? Share this live stream at least 3 times, all right? Make sure all of your shares are set to public and answer all 3 questions in one single comment. I repeat once again, just like Fight Club, in order for you to participate in this quiz, you've got to follow these 3 simple steps. First, share the live stream at least 3 times. Make sure that all your shares are set to public and answer all 3 quiz questions in one single comment. All right, with that, let's move on to our quiz. Okay, it's a true and false question, folks. Question number 1. Erectile dysfunction is a sign of potentially more serious health condition. True or false? Once again, I repeat, question number 1. ED is a sign of potentially more serious health condition. Is it correct or false? Question number 2. Premature ejaculation affects fertility. True or false? Repeat. Premature ejaculation affects fertility. Is it correct or false? Number 3, our final question of the day. There are currently no medications available to treat premature ejaculation. Now, if you paid attention, you would know this is very, very easy. Once again, the question is question number 3. There are currently no medications available to treat premature ejaculation. True or false? 3 questions. Make sure you type all of the answers in one single comment. All right. Share it, and we will get back to you with the answer. Until then, we're going to continue back where we left off in terms of the slide. Okay. Make sure you answer, folks. And if you don't know, whatever you do in life, don't use Chat GPT. All right. You have to attend seminars like the one provided by Dr. Vijayan. You can't rely on technology every time. Now, back to you, doctor. Okay. We're moving on from PE. Let's go to ED.
Yep. Okay. So ED. Now this is a little bit more. You have more things to do. Why? Because like I said, you can actually target other things, other areas. Lifestyle changes, commonest cause like smoking, exercise. You can get them to reduce their weight, reduce their alcohol intake. All these things you can actually try to reduce the core problems associated with erectile dysfunction. Now, then while that is going on, okay, if that works, fine. If it doesn't, a lot of people tend to add a little bit of the goodies inside. And this is, you talk about your tablets, your Viagra, your Cialis, which is available. You see the doctors, get a consult, make sure you don't have any contraindications. They can actually consider this. A lot of times we tend to go for these medications first. If everything else fails, we tend to do medications first. Now, in terms of medications, there are injectables where you can inject what we call alprostadil, or the trade name is Cavijet, into the penis directly about half an hour to an hour prior to the sexual intercourse, and usually it works wonders, but you will have to self-inject. That is something that a lot of men are not so comfortable with. It has been used before, we have used it, not so common, all right, is there. Now, other things, like I said, depending on the cause, if you are actually have somebody who has low testosterone level, hormonal replacement therapy will bring the testosterone levels back up, and then your erectile dysfunction actually should respond and will respond to it if that is the cause. Now, other things like shockwave lithotripsy, there are these modalities that are available. Is it the main standard routine standard of care? Not really, but there are studies that have shown that it does work, especially for those with mild to moderate erectile dysfunction that is not related to surgery or radiation. You can try this. Of course, counseling is always part of it. And then the last one I put there, devices, and I spoke about this in brief just now. We're talking about vacuum devices. It's available in the market. These are for patients who fail medication. Then they have implants. Implants is the the other extreme, where everything has failed and the patient still wants to have satisfactory and enjoyable sexual life. Yes, you can consider getting implants. They are not cheap, but it can be done. There are centers in Malaysia who do this. It's available. So these are the options of treatment for erectile dysfunction.
I like the fact that we're talking about the solutions here because it's calmed a lot of nerves, a lot of people who are tuning in. We've got 41. We already, more people are coming in. And thank God they come in the right time because this is the cure. This is the solution that everybody's looking forward to understand, all right, on how they can actually solve their problems. But folks, we maintain that at the end of the day, while there are solutions, you have to go and consult your doctor or urologist, all right, to understand the underlying problems behind you. It could be psychosocial, it could be physical. You never know until you get yourself checked. Now, doctor, I just want to ask, right? When it comes to medications, I mean, it's a common question, right? People, I believe, they start off with Viagra or Cialis or Tadalafil. Am I pronouncing that right?
Yes.
Is there
Yes.
a better version? Which one is better, or are they just the same? It's just a brand thing.
Well, not everyone responds the same to these medications. Some people who respond to Viagra do not respond to Cialis. Some patients respond to Cialis, but they don't respond to Viagra. So it is a bit of an individual thing. It's not to say one is better than the other. The only difference maybe with Cialis and some of the other medications like Udenafil and a few others that I did not mention here, they are single dose usually and when needed. Whereas Viagra is, you can titrate depending on the dosage. There are various preparations to it. So you can titrate it up if needed. So that is actually not really an issue. It again depends on each patient.
Right. And doctor, this isn't not a popular question to be asked by many, but I understand some are asking already. Viagra, Cialis is actually easily affordable and also accessible to the public, right? A lot of people jump and think, oh, I have performance issues. I might as well go get myself a batch of Viagra or Cialis to perform straight away. And some people jump straight away to take 20 milligrams or go overdose. Have you had those type of cases before?
Well, I've not seen overdose per se, but what has happened is people don't get a consultation. They straight away go and buy over the counter, or that's not too bad, buying over the counter. But the fear is when they start buying over social media platforms, where you don't know what you're getting. You think you're getting the original, but it's actually adulterated. And this is where the danger happens. And we've had instances where people pass on because they have taken something like this. They don't highlight it, but they've taken something like this, and it causes problems with your heart and whatever not. So there are dangers of taking this on your own. Now, certain patients who have heart conditions, weak hearts, they shouldn't be taking this without the consent or allowance from the cardiologist. So these are the reasons why you need to go and see your doctors, because you really need to know. It's not the same for everybody. The risks are there also. So you just have to be careful with it.
All right. Now you heard it, folks, from the doctor himself. All right. You've got to don't simply buy things from Shopee or Lazada. I'm not condoning for you to buy because I have a Shopee account myself, but don't simply buy, medication for your PE or ED over there. It's best to consult a professional. All right. Moving on. Okay. Now we've always talked about the solutions, the problems, but all right, we want to understand from you, doctor. All right. Can we go to the next slide? Despite the fact that we there's so much science behind it, there's so much cure and solutions given to individuals. Why is it that PE and ED, why is it still considered a taboo, especially in Malaysia?
Yeah. So in general, let's put it this way: all men, all races, okay, have confidence issues, ego issues to talk about this. You don't want to be seen to be lesser than your next friend or your next guy who's there in your office. It's something as you take it as a taboo. You make it into a taboo because you feel inferior if you have these issues. All right. This is just associated from a time-old thing. Oh, I am better in bed than the next person. There's a sexual prowess issue, machoism. From Neanderthal days. This has carried on forward till now. And amongst Asian men, this inferiority complex is even worse. You see, we feel that we are not as good, so we try to hide it. We don't talk about it. We say, look, this is just aging. I don't need this. It's okay. It doesn't matter. So in general, it just makes you feel that you are a lesser person, which is not good. You shouldn't have to feel that. You shouldn't have to feel that. You are as good as anybody else. So it's good that you seek treatment, you talk about it. You go and talk to the Western men. If you have seen the Western guys, they come out and they just talk. They may not know anything, but they'll be talking. They're so confident, and that is how they even face these issues. They will go and talk about it because they know they don't know, they'll go and ask. Whereas we don't know, but we don't want to ask because we're very shy.
I agree. You know what? I'm going to, change myself. I'm going to take a new, what do you call it? A new leaf here. Tomorrow, I'm going to walk into my boss's office and I said, "Hey, let's be mature men. Let's talk about ED and PE. If I get fired, I know who to blame." It's a nice start, right? Boss, we got to talk about grown-up stuff. All right, and now I understand that there are various issues that we need to talk about, especially the whole act of comparing one another. It's a different ball game, folks. At the end of the day, it's just you and you. Now, moving on from an individual ego issue, right? There's also the issue with partners or your loved ones, which goes off to our next slide. There you. Oh, we are still continuing with the taboo. My sincere apologies. Before we go to the issue with the partners, perhaps Dr. Vijayan, you want to dish out on this slide?
Okay, yeah. So basically, what we want to tell is you shouldn't be fearful. The fear is because you don't know earlier. What you don't know makes it more fearful. All right. You need some time and space, okay, to acknowledge that there is a problem, and you want to face the problem. All right. Then once you say you can face the problem, you want to face the problem, then you can find a solution. This is where the mindset is important, rather than keeping it within yourself. Now, saying all this, of course, is easier said than done. And the interesting thing is, as you age, you tend to get a bit more mature, and things that was harder to process over time, you start being able to process. And interestingly, I have to say this. I have noticed that the older men nowadays, many more are coming in to talk about ED. And when I just casually ask them, how did you decide that you wanted to come? Say, oh, I was just talking to my group of friends after the evening prayers. They're having a cup of teh tarik at the stall, and we say, oh yeah, we're just talking, and of course teh tarik is one of the causes, but sugars and all that. But basically they can say, they were talking about it, and then they brought this issue up. So the discussion is slowly opening up. It's slowly opening up, especially in a bit of an older age group. You're starting to see this group coming in. So it's there, but hopefully you start to see more people willing to open up and talk about it.
All right. Which leads me to my question. All right. It's so good that people are starting to talk more and more about it. But how can we, right? You're a professional, you help me, okay? How do lay people, or laymen, actually speed up the process? We want to talk about this. We want to have a robust discussion. Do you have any solutions for this problem? Because at the end of the day, people are still shy. Although people are
Yeah.
talking about it, it's minimum. So how do we speed
Okay.
up the process?
So issues like this should be normalized. Now,
Mhm.
aging, okay, as I think somebody has commented in the comment section, women go to see a gynecologist for issues related to women. Men should be going to see the urologist in relation to these issues, but a lot of men don't want to do that. So this discussion should be normalized. It shouldn't be just happening during Movember. It should be there in the rest of the year. Men's health is not just about the month of November. It should be carried on throughout the year. Every now and then there should be reminders. Men's health is not just prostate cancer. Everybody thinks, oh, men's health, November is prostate cancer. No, it's not necessarily that. There are a lot of other things related to men, and men have to take care of themselves. If you don't take care of yourself, who is going to do that for you? Okay, so these are things that you should acknowledge. You should be empowered to say, hey, look, I'm a person, I also have problems, and I should go and talk to somebody and ask and get treatment. If there is treatment, why not? There must be you must feel that you want to get better. All right, you must acknowledge it.
All right. Beautiful. Again, everything ties back to you, folks. You want to get better, you want to kickstart the conversation. It all starts with you. So, after this, we expect people to pop up on social media, talk about it on TikTok, social media platform, whatever it is. Even if you're still using Facebook or Friendster, start a discussion, make it active, make sure we break the stigma. Moving on to our next slide, we're talking about whether it's still why it's still a taboo. Now we want to talk about something aside from the individual suffering from PMED. What about their loved ones? All right, when it comes to their partners, having a supportive partner is always key in solving this issue. So, doctor, maybe you can explain further.
So this is a very important part, because I always think that it, if you have the support and trust of your partner along on this journey to try to solve this problem, you will reach the goal much faster, okay, with much better success. Now, why is this so? Now, if you are with your partner and you are facing this issue of either premature ejaculation or erectile dysfunction, you can go two ways. One, you can go the negative way, we say, I keep it within myself, I suffer, and the relationship suffers because it just perpetuates. The cycle just keeps repeating. You don't break it, you don't get it better. Okay? But if your partner and you have a very good relationship based on trust, then you can talk openly about, hey, look, I have this problem. I think, what do you think? I'm sure you are not happy with me. And say, no. And the partner says, look, yeah, I realize you have a problem. Why not we seek treatment? Why not we go and find a solution? And I'll be there to support you. Let's listen to this together. Let's do this together. Yeah? Let's learn how to get this. And this is the thing that I notice this when the patient comes with the partner. And the partners are equally affected because there is some dissatisfaction because things are not normal in the bedroom. So if they acknowledge this together and come to seek treatment, that is likely to succeed. The treatment is likely to succeed there. You see? So just keeping silent is not golden in this situation. Okay? And it just may perpetuate the thing to get worse. The relationship itself can get strained. That leads to more emotional stress, and that worsens things. So go together, get seen together, get support together. And this is where, once you have the support, you can have an open discussion. You can talk about anything under the sun. And you can say, hey, look, like you were talking about, foreplay and all that. A lot of people think, I don't want to talk about it. But once you start talking to them and they open up, and you can say, hey, look, why don't you try this? Why don't you try this? Why don't you concentrate on this a little bit more? And you'll be surprised. They actually respond very, very well. With or without medication, they can respond very, very well.
All right. I'm going to ask you a question. I'm going to throw you a curveball, okay?
Yeah.
How exactly, how do you think couples can talk more about this without causing embarrassment? Because with Asians especially, right, if I go couples therapy, I bring all my ex-girlfriends, right? Let's talk about me, my problems, okay? Why did you not stay with me? All right. Even if it goes to my sex life, how do we talk about it without causing embarrassment? That's my question.
So okay, one, that is the trust there, There shouldn't be any embarrassment when you have trust with your partner. It may be a long-term partner, it may be a short partner, but if there is trust, and that is something that you as the patient have to determine yourself, if you have trust in the person that you're sharing your life with. Again, whether it's short-term or long-term, it doesn't really matter. The trust is the most important. If you realize it's short-term partners, no trust, then you have a problem there. Okay, then you may not bring your partner along. But those who do bring their partners along, you think that there is some trust built in, you explore that trust. And then you start talking about it. And then you say, hey, look, I'm going to talk a little bit deeper. Your partner is here. You want to share together. And if they say yes, then you know that, look, they have an open conversation, which is good, which is very good. But those who don't have that, you must try to push them towards that.
I love when you talk about couples and joint therapy. I will be calling all my 7 exes. We're gonna go and do joint therapy after this. Okay. Now, I just jokes aside, I'm speaking on behalf of the other couples here that are in attendance. When they go for all these joint consultations, right, joint therapy to address these issues, right, maybe in the first go, it's a bit tough for them to talk about it. In your experience, what would be the most helpful thing that a partner can say to kickstart this discussion about ED or PE?
Okay, so there are, you can put it this way, if the partner themselves comes across and say, hey, look, both of us decide, she comes and say, hey, both of us decided that we wanted to approach you and want to talk about this problem. He's shy about it, but he wants me along. And that itself tells you that there is that trust, Shy men, yes, totally understandable. They don't want to face it alone. They bring their partner along. That itself is already a very, very good sign that there is a very good relationship there. That they have spoken about it. They want to come, but they're scared to come alone. They bring their partner along. Okay? That is a good sign there. That itself is the first good sign that you want to see.
Okay. See, those are your solutions, folks. And I believe that is the end of our presentation. Am I correct? Yes, it is. Now, folks, before we continue, right, we want to thank you so much to our guest speaker here today. Can we give him a round of applause? All right, everybody's giving a digital clap right now. But on behalf
thank you. Thank you.
We thank you, Dr. Vijayan. Thank you so much.
Thank you so much. Thank you so much. Thank you so much.
I know that there was a cure, and I don't even have these things, but I feel honored to have been able to discuss this in a safe and also non-joking environment. It's very helpful, very informative. Now, folks, before we pass the mic back again to Dr. Vijayan, I just want to remind you, okay, the quiz section is still open. Now, people have been throwing their answers, and you can still participate. Once again, all you need to do is answer those 3 questions, all right? Share on the live stream at least 3 times. Make sure all your shares are set to public, and remember to answer all 3 questions in the comments section. We will be unveiling the winner later. Don't you go anywhere. Stay tuned to find out who comes on top in our pop quiz for today. In the meantime, thank you so much, Dr. Vijayan. Or maybe before we go into the Q&A, perhaps you want to give a shout out or maybe a tip for all of the individuals that popped up into our live stream. Any parting words to give them?
Yeah. Thank you for joining. It's great to see that you are listening in. Whether you are the patient or you have friends who are facing these problems, suffering this silently, you can help pass this message along. They don't have to suffer in silence. They just have to come, sit down, meet up with a urologist, sit down and tell them, look, you have this problem. This is not uncommon. It can be common, as you saw earlier, and it can be treated. There are ways to treat this. Don't let your life go on like this. There's so much more to it in life. You don't have to worry about this, don't have to fear about this. Go and get yourself.
Oh, hello? I think we lost it. Oh, okay. I think I froze just now, but yes, as to what the doctor said, I think you should get help, folks. And for those who are suffering, don't suffer in silence. It's always good to talk about it. It's always good to consult somebody, or especially a professional. And if you are looking professional, don't look anywhere else. Head towards Columbia Asia Hospital. Dr. Vijayan will be there, all right, to graciously welcome you with open arms. I think doctor is somehow stuck over there. That's the thing about connection, folks. But don't you worry. All right. Well, wait. Oh, he's back. Wow.
Yeah.
He just decided to do a cliffhanger. But yeah, I'm just recapping the point you said, Dr. Jan. And since you're back, we are going towards our Q&A. A couple of you or a dozen of you threw in questions in the live chat. We're going to address them right now. All right. Okay, let's go on through the first series of questions. Doctor, I'm going to read this for you. Hi, not sure if you covered this. Or could overconsumption of coffee and caffeinated drinks also contribute to these conditions? This is from Ashley Chong.
Right. Okay. So there are multiple ways of answering this. Now, in general, no, it shouldn't cause these issues with PE or ED. But if you look at it, some people who do take too much of coffee, they get anxiety. Okay, can anxiety lead to problems? Yes, it's possible. All right, but in general, not the content itself, but if you are the anxious type, yes. If you tend to get sweaty hands and blah 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 because of all this, yes, possible. Caffeinated drinks on its own, no. Again, it's not directly related, but if you think about it, caffeinated drinks like Coke, Pepsi, and whatever not, these are all high in sugars. High in sugars, you take this on a regular, continuous basis, you lead towards diabetes. Diabetes leads to worsening of your vascular conditions, and that can lead to erectile dysfunction. So, in the long run, yes.
Now, doctor, I just want to ask, right, just a supplement question from Ashley, who strangely enough looks like my sister. Doctor, when you say overconsumption of coffee, right, what is defined as overconsumption? 1, 2, 3, 4, 5 cups?
Your guess is as good as mine. There is no actual, personally, as far as I know, there's no definition that I'm aware of. And honestly, I'm a coffee lover myself.
Same.
3 cups, 4 cups of coffee is not a problem. But some people take 1 cup of coffee and they get into trouble. So it's not the same for everybody. All right?
Okay, thank God. If that's the case, I will stick to my 5 to 6 cups of coffee every single day. I cannot function without it. Thanks a lot, Ashley, for that question. Let's move on to the next. Oh, all the way from Sakina Al-Junit. All right, the question is such. Smoking is a cause for everything in caps lock. Hi, Amirul. Hi, Dr. Vijayan. Good topic because men are too shy to talk about this, so they suffer in silence. Doctor, is smoking a cause for everything?
Oh, yeah, well, let's put it this way. You can find smoking as a cause for almost everything under the sun, from cancer to diabetes, to high blood pressure, to heart problems. You name it, smoking is there. Why? Because these are actually social demographic studies, and many people are smoking. They have other issues together. Now, is it a correlation or is it a contributing factor? We think there are some that are contributing, some are correlated, but it's there. Unfortunately, it's bundled together, and you look at all this demographic data, it tells you that this is the likelihood. It will cause cancers, it can cause erectile dysfunction, things like that. No issues. We know that.
So, doctor, I mean, I'm guessing you're taking a safe approach while studies are not there yet. I'm supposing vaping is also part of it. So you want to cure ED, PD, you got to take out vaping as well, correct?
Yeah. So at this point in time, the general belief, there are some short-term studies saying that it's the same as smoking. Again, this is just short-term studies. We have to see long-term studies because smoking has been there for years and we know there are causative factors. We are thinking that vaping with its contents are almost similar. And short-term studies have shown similar findings. The long-term studies are, the suspicion is it's going to be the same thing again.
All right, let's say I don't want to prolong this, but you have a lot of individuals in the chat room who are heavy chain smokers. Good God, they say I'm strong like a bull. So maybe it's an individual type of thing. But okay, let's say they are an aggressive chain smoking individual. If they stop now, right, in your professional and advice or your professional line, how long can they see improvements in terms of their loins?
Okay, so there are various grades of improvement depending on what you're looking at. If you're looking at your quality of life in terms of your breathing, your sleep patterns, and all that, you may see if you go cold turkey and stop completely, you may see an improvement in your sleep and your breathing within about 2 weeks. All right, within 2 weeks you can start seeing improvement. Now you're talking about risk for cancer, anywhere between 6 to 10 years. Then you go back to your normal risk, normal population risk. So it takes time. It takes time for whatever abuse you have done to yourself for it to be cleared.
All right. So, folks, if it's going to take some time, you better throw away those cigarettes, those vapes, those IQOS, or whatever electronic cigarettes out the window, folks. To me, I'm going to start and take a tong barrel. I'm going to put all my electronic cigarettes, I'm going to burn them today, tonight. No more. I'm scared.
Well done.
All right, moving on to the next question. What do we have? Okay, this is all the way from Yi King. What's the best way for a woman to bring up these conversations without making her partner feel judged? We just covered this, but hey, doctor, maybe you can recap for them.
Yeah. So again, the amount of trust, the amount of comfortability within the relationship will play a heavy role in this. How do you approach your man to talk about this? And if you have a very, very comfortable relationship, then there's no issues. Hey, look, do you think that you're not as active as before? Are you feeling more tired? Are you feeling a little bit more lethargic? Are you having problems? Things that you skirt around the issue and slowly try to bring it back to what happens in the bedroom. So these are things that you can slowly go around it and try to bring it back to how it's affecting you as the partner. Yeah. So it's there. It's available. You can do it.
All right, doctor. Now, I'm so sorry to cut this Q&A session short, folks, but we are almost at the tail end of our section. We got to speed up, ramp up, warp up until the end of our show. So I believe maybe we can take one more question. Do we have any more questions, guys? Last one for the day. Okay, we'll keep it short, doctor. Okay, this is from C To Kawai. All right, doctor, what's your opinion regarding PRP injection for treatment of ED?
So platelet-rich plasma, okay? So there are some clinics who are offering this. Now, this has not come into mainstream yet. There are some small centers doing randomized studies overseas that see some improvement, but it has not become standard of care yet. We do not recommend it per se, but we know there are private clinics who are offering this and to a various degrees of success. We don't know whether this is sustainable, whether this is without harm on its own. So we would advise you to stay away from this.
All right. Now moving on, we also have another question, right? Okay, this is predominantly from some of our Malay audience viewers. It's popping up a bit slow on the screen, but so I'll just read it for you, doctor. Sure. Now, is Tongkat Ali a good alternative or a good solution? These are for our Malay brothers and sisters. What is your position in Tongkat Ali? Myth or is it fact?
So no, well, I think there was some research a long time back that showed Tongkat Ali having some properties, but the problem with this is the concentration is not consistent amongst the various preparations, and along the way it's been adulterated. Now I think we have heard reports of Tongkat Ali having there are steroids inside it mixed together. It's like ginseng, similar issue. We have this problem where we do not know what exactly is the content anymore. It is not pure Tongkat Ali anymore, so we cannot recommend this itself. People used to say yes, it does work, but that we don't have the same concentration anymore. We don't know.
All right. Now on that, folks, we are ending our Q&A section. Thank you so much. But if you have any more questions, you can push them, or you can actually direct them to Dr. Vijayan at his official email, in which we'll be giving out later on. Now, in the meantime, all right, we're going to circle back to our quiz. Now, we already have the results in our hand, but before we do so, we're going to tell you the answers for this, all right? And the doctor, all right, Dr. Vijayan is going to tell you the answer. So, doctor, we'll go one by one first. Erectile dysfunction is a sign of potentially more serious health condition. What's the answer?
True.
Oh, all right. Congratulations. Who got that right? All right. Question number 2. Premature ejaculation affects fertility. Correcto
Not true.
or false?
No.
God, my mind is blown. And number 3, there are currently no medications available to treat premature ejaculation.
Not true.
Not true. All right, those are the answers from the doctor. All right, let's see. All right, let's move on to our award, our announcement of the winners. Okay. All right, we already have the results in our hands. We've already tabulated. Thank you so much to everybody for participating. See, quite the number of comments coming in is still coming in. We've already closed it, folks. And here are the results. All right. Okay. I've been practicing my drum rolls. We already have 3 winners, folks. Okay, 3 winners. All right. Now, let's start off with second runner-up. Ladies and gentlemen, coming in 3rd place. Drum rolls, Dr. Vijayan. All right. Coming at number 3 is C Stars. Congratulations to C Stars for winning 3rd place. All right. Congratulations. You've been a very attentive viewer. Coming up in first runner-up or 2nd place. Once again, Dr. Vijayan, give us your best drum roll impression. All right. It is Ella Joy. Congratulations, Ella. All right, and beating everybody to the punch, ladies and gentlemen, top for today, number 1. Please welcome to the stage, to the podium. Drum rolls. Please welcome Choki Honey. All right, congratulations, folks. Congratulations to Choki Honey, Ella Joy, and C Stars. Now, folks, we will be in touch with you. Our representatives from Columbia Asia Hospital Setapak will be there to connect with you, to get your details, to send you the mystery gift, and we hope you enjoy and relish the gifts that we're about to send to you, okay? Now, before we move off, Dr. Vijayan, is there anything, once again, you want to share with the audience before we wrap up our show?
Well, to the men out there, you're not alone. It's a common problem. Go see your doctors. Discuss it openly. Bring your partners along for the support. All right? You're not alone. It can be treated.
Once again, on behalf of the organizer and also on behalf of the folks here, all right, thank you so much for participating on today's live stream, folks. You've been a great audience. And if you have any queries or maybe questions, or if you want to seek consultation, once again, we encourage you to get the best assistant there is. Head down towards Columbia Asia Hospital Setapak. All right, the folks are there ready with that lab coat. Open arms. They're going to help you throughout everything, PE or ED. They're the men and women that will fight for you with reasonable rates. So do head towards Columbia Asia Hospital. Once again, thank you so much for attending. Remember, all right, speaking about it is the best. That is the first step to addressing PE and ED. So on behalf of everyone, thank you so much for joining. We'll see you in the next edition of Doctors Go Live. Thank you so much, folks.
Thank you. Bye-bye.